Let's review a clinical case of a 46-year-old woman with extremely dense breast tissue using the Koning viewer. When the study is opened in the Koning viewer, if there are multiple series in the study, the default side-by-side comparison layout is displayed. In this layout, each row represents an anatomic plane, and each column is an image series. From top to bottom, the planes are transverse view, sagittal view, and coronal view. Default window level, projection type, slab thickness, and zoom ratio are preloaded. We can double-click any view to expand that view to full screen. We initiate the image review by selecting a preferred view, for instance, the sagittal view. We can double-click the row to bring that view to full screen. We can make necessary adjustments using the tools provided by the viewer. Now we use the Browse tool to begin browsing from medial to lateral. As we move forward, we can observe that this patient has extremely dense breast tissue. For diagnostic purposes, especially in patients with symptoms and very dense breasts, contrast KVCT imaging greatly aids not only in identifying any suspicious findings within the dense tissue, but also in examining the extent of disease simultaneously. In this case of extremely dense breast, we don't detect any suspicious calcifications in the non-contrast image. Some areas may exhibit suspicious speculation, although it's not very pronounced. In the contrast enhanced series, we identify a large enhanced area in the upper outer quadrant. The whole area has an irregular shape, heterogeneous enhancement, and micro speculations at the margin. Use the ellipso tool to measure the difference between pre-contrast and post-contrast in the same region. The measurement shows that there are approximately 90 Hounsfield units increase due to the contrast enhancement. We can move the crosshair to the suspicious findings and examine other planes. While we are examining the extent of disease, we do find that this enhanced area covers a wider volume in the dense tissue. Pathology results have confirmed that two samples from 1 o'clock and 2 o'clock positions in the upper outer quadrant contain invasive ductal carcinoma.